So for my disorder, I had schizoaffective disorder. Schizoaffective disorder is characterized as a mental health disorder in which schizophrenic symptoms are found in tandem with those of mood disorders. This means that individuals with schizoaffective disorder are afflicted by hallucinations and delusions, as well as mood swings and depressive or manic tendencies. So there are two main types of schizoaffective disorder, the first one being the bipolar type, in which patients mainly suffer from mania and depression, and the depressive type, in which depressive episodes are the primary markers. Unfortunately, schizoaffective disorder is not one that can go untreated. Those afflicted often experience delusions, auditory and visual hallucinations, impaired ability to communicate and trouble speaking, depression and bizarre behavior, manic patterns, or often issues in self-management like grooming and basic household tasks. So while scientists are still unsure about the causes behind schizoaffective disorder, there is evidence suggesting that a hormonal imbalance of the neurotransmitters serotonin and dopamine may be a direct cause. There is also substantial theories attempting to prove a genetic cause behind the illness. Aside from these factors, scientists believe that environmental factors, exposure to toxins and viruses in the womb, and birth defects may all be unfortunate causes of schizoaffective disorder. So many people fear those with schizoaffective disorder because it is extremely difficult to understand. Many people fear those with schizoaffective disorder because it is extremely difficult to understand. Many align those with schizophrenic symptoms as being dangerous. Media portrayals of the disease are often extremely negative. Movies like Girl Interrupted starring Angelina Jolie and Winona Ryder, as well as The Voices with Ryan Reynolds, are some high-profile examples of films depicting schizophrenia and its extensions negatively. In the first movie, Jolie, a schizophrenic living in a woman's mental institution, is extremely abusive towards Ryder, a fellow patient, and even attempts to murder her as well as kill herself. Reynolds himself plays a murderer as well, driven to commit crimes because of the voices in his head that tell him to. These kinds of images are incredibly harmful to the schizoaffective community because they spread misinformation and actively prevent individuals from getting treatment. Though outrageous and theatrical portrayals often prevent real schizoaffective people from recognizing their own similarities and lead their friends and families to unfortunately believe that schizoaffective individuals are dangerous and that they can't be helped. The reality of schizoaffective disorder is that it is just an illness like any other, and those sick with it deserve to be treated and find a place for themselves in society like anybody else. As far as schizoaffective brain function, a recent study found that brains of individuals afflicted with schizoaffective disorders have reduced expression in the HDAC enzyme, which is responsible for cognitive function. Because this enzyme is linked with epigenetics, it is therefore assumed that at least some forms of schizoaffective disorders are caused by non-genetically predetermined factors. And if you look at the diagram, there is significant difference in brain activity versus patients who have schizoaffective disorder and those who are healthy. There are several areas of the brain that are impacted in a schizoaffective individual, including the prefrontal cortex, basal ganglia, auditory cortex, visual cortex, and the amygdala. And if we look on the diagram on the previous slide, the one that was most impacted was the prefrontal cortex. The prefrontal cortex is often less active in those with schizoaffective disorders, meaning that they are not using the part of the brain that utilizes critical thinking. It also helps to organize thoughts, leading many afflicted to have disordered thinking and delusions. Hallucinations are often reflected in the visual and auditory cortex, which are much more active in a schizoaffective individual's brain. To them, they're not seeing hallucinations, it's real life. So a good place to start for those who suspect they might have schizoaffective disorder is a physical exam, which can help to rule out other possible causes for their symptoms. Following this, screenings are important and may include MRIs and CT scans to determine brain abnormalities. A psychiatric evaluation is then recommended based on findings and will help put the patient on the right path towards recovery utilizing therapy medications. There are three major types of medications schizoaffective types are often prescribed. Antipsychotics, the only medication approved by the FDA for schizoaffectives, and it helps to manage delusions. Mood-stabilizing medications for bipolar types who have difficulty with mania and mood swings, and antidepressants, which help to increase serotonin and dopamine in patients to alleviate sadness and hopeless feelings. So who gets schizoaffective disorder? Here are three graphs to kind of demonstrate who is affected by schizoaffective disorder in the US. So if we look at the first one, individuals who are afflicted already with other disorders have a higher predisposition to develop schizoaffective disorder, as we see from the first graph. In the second image, we see that 1 in 200 develop schizoaffective disorder at some point in their lives. This makes it a not-so-uncommon disease. And in the third one, we learn that 725,000 American adults have schizoaffective disorder, and women are way more likely to develop schizoaffective disorder than men. There are two main treatment organizations that I want to talk about in this presentation, the first one being The Ranch in Tennessee. It's a famous mental health clinic, mostly for their addiction programs, but they also feature a specialty in schizoaffective treatment. Therapy and medications work hand in hand here to provide patients with the best possible treatment. Cascade Behavioral Facility is also another viable option. So in conclusion, those with schizoaffective disorders are not monsters, and they are not dangerous. It is an illness just like any other, and those afflicted by it deserve respect and understanding from the public, not repulsion and fear. Do not let the media dissuade you from compassion, and keep an open mind for the world and its people.